Just a little clarification, when I talk about what we do, typically people say, oh, great, you've got an incubator. And we say, no, we actually don't have an incubator, we have an accelerator. And just to provide a little bit of context in terms of the difference, this is important. An incubator traditionally in this space is when an entrepreneur or a really smart person has an idea, and they take that idea and they want to run with it, and they want to iterate and prototype and develop something. Ultimately, that's not what we're doing. Our goal is to take it a step beyond that. So once that entrepreneur has had their idea and they've actually developed their idea and they've actually built a company, a small company that is looking for pilots, that's looking for some seed funding, that's looking for traction, that's when we want them to apply to our program. So there are other incubators out there in the space. There's a really great one called Startup Next in Los Angeles that I encourage a lot of you to check out. Great place for entrepreneurs in healthcare technology to really get themselves into the process. But ultimately, we're looking for companies that have a product, have a founder, full-time founding team that's really looking for ways to accelerate the growth of their innovation. And so what is this program? So our program is a 3-month accelerator. It's going to run from March 28th to June 23rd every year for the next 5 years. We're going to take 10 to 12 startup companies, earlier stage, so companies that have a product but may not have had multiple rounds of funding, may not have had lots and lots of traction, but still companies that have done some really cool, interesting work. And we're going to work with them very closely and mentor them, coach them, guide them, even provide a lot of our resources to help sort of collaborate and co-design some of these great innovations in healthcare for Cedars and also for others. So we're not looking at this as just an internal partnership, but actually the goal is to work with these companies and actually help diffuse or spread innovation across Los Angeles, California, and ideally across the country and even broader. A little history about Techstars. I'm not sure if you guys are familiar with this company. We've learned that they are the leader, if not one of the top 3, Y Combinator being another one, leaders in building accelerator programs around the world. Not just healthcare, just accelerator programs. So they have 22 programs currently live in cities ranging from New York, Boston, Chicago, all the way to Tel Aviv, Cape Town, London, all around the world. And so what they do is they bring companies together, 10 to 12 companies, provide a little bit of funding, surround them, put them in this boot camp environment, and in 3 months they get done what would have typically taken a year, maybe more, because it's just this robust boot camp period. So this is the Techstars, part of the Techstars portfolio. So they partner exclusively with industry leaders in the various spaces. So they've got a retail innovation hub in Minneapolis with Target. Up in Burbank, they've got an entertainment one with Disney. They've got one with Barclays for financial innovation, and they're working with us, Cedars-Sinai, as their exclusive partner for the next 5 years in healthcare innovation. So we're really proud to be working with these guys. As you can see, the brands on the screen are great companies, and we're excited to be part of that group. So Techstars, if you think of the traditional startup company, typically the success rate of a startup company is anywhere between 8 and 10%, 8 and 12%. The Techstars has had over 700 companies in their portfolio, and to date, they have a 90% success rate, meaning these companies are either acquired or still profitable, and that's great. I mean, that's sort of flipping the traditional model, largely by picking the right companies and then surrounding them with the right mentors to make sure these companies succeed. So what does that mean? So it's a 13-week program, as I mentioned, March 28th to June 23rd. 10 companies, we may pick 12, and we're providing Techstars and Cedars-Sinai, these companies, with $120,000 in seed funding in exchange for somewhere around 6% equity in their company. So it's a cash for equity exchange, and it's a different model, but it's our way of really trying to find a way to really build innovation from outside, take the innovation that's going on outside the hospital and find ways to really bring it inside the hospital. And so we've been blown away by the number of applicants we've had to our program. Applications closed a couple weeks ago. We've got applicants from Europe, from Africa, all over the country, including the East Coast and the West Coast. It's an important point because the requirement for the program is these companies need to relocate to Los Angeles. They need to move at least some members of their team for the 3 months or even longer to LA, which is not only great for us, but great for all of you, because now we're taking some of the best entrepreneurs from the Bay Area, from New York, from Boston, DC, Chicago, Europe, and we're bringing them here to LA. So we create some great pilots, some great partnerships, not just with Cedars, but many of you, and it could be a great opportunity for us to work with many of you to really spread innovation really quickly. The panel before was talking about different strategies, whether you build, you buy, you have an innovation garage, a lab, with really cool ideas. This is another one. So we've got an accelerator. We're working with a company doing a little equity exchange to really make sure all sides are interested and really accountable for growth. And these are the kinds of companies we've seen in our first pool. We've had hundreds of applications, and we're really proud of the pool. From that hundreds of applications, we've got to pick 10 now. But these are the kinds of companies that have applied. So March 1st, companies will be selected. March 28th, the program begins in West Hollywood. Program runs through June 23rd. You may want to mark your calendars. June 23rd is going to be our big demo day, so you can come out, likely either in LA or Beverly Hills, somewhere on the west side. I'll fill a room with 500, 600 people, including many people from the healthcare industry, investors, press, other important officials from the government. And these companies, these small startup companies, will have a great venue to be able to pitch what they're doing to people who could ideally give them some pilots. And again, we'd love to have as many of you out there as possible. More so, we'd love to invite you to our space. The program's going to be live, like I said, April, May, and June. We're right in West Hollywood, right on campus at Cedars-Sinai. So for those of you who are in LA, San Vicente and Beverly, right by the Beverly Center, is going to be a 2-floor dedicated space. We're taking an old furniture store, gutting it, and it's going to be an innovation hub for us, where we're going to be able to have these companies co-working, co-sharing space and ideas, working with industry leaders and mentors from across the health system at Cedars and also just the healthcare industry to really help grow their businesses. So my other push for you is A, would love for you guys to come to Demo Day. B, would love for you guys to come to our program just to visit the companies. And C, if you're interested in being a mentor, I would love for you to contact me. This program runs and functions if we can connect these early stage young companies, not young entrepreneurs, but young companies with people like you, people who understand what it's like to work in the healthcare industry, especially people who understand healthcare information and health information. The panelists that we just heard, all of you probably have great stories to tell. You can really help make a difference in these companies. And so the commitment's pretty much an hour a week, maybe a couple hours a month. If you can come out to our space, meet with the companies, provide them guidance and feedback. I've got my contact information on the last slide. Keep that in your head, and if you're interested, please email me and I'll tell you what that entails. It's give first, right? So we're not paying, this is a volunteer kind of thing, but we think it'll pay huge dividends in the healthcare community, because if we can get our collective brain power together and help these companies, we think that they will in turn be able to provide a great amount of value. The story from this really starts with, I bet many of you are approached by startup companies all the time. It sounds like from the panelists you all are. We are too. And the challenge is, many times they do their pitch and it's this amazing pitch, but once they leave, we all sort of sit in a room and we say, well, if they'd only talked to us, we would have told them that, it's great, except the last 20% would never work in a hospital. Well, here's our chance to actually work with these folks and really sit down with them for 3 months, help them co-design their apps, their software, their devices, their marketplace, whatever it is that they're trying to do, help them do it in a way that's constructive for all of us. Just a quick slide. Many of you may recognize some of these faces. Darren Dworkin, many of you may know, he's our Chief Information Officer. He's the executive lead and my boss on this project, and various other folks from Cedars-Sinai are on our advisory board. And we're really thinking of this as one of many front doors for Cedars-Sinai. These are potential opportunities for us to engage. Again, we're going through a formal process. Someone asked the question about how do you manage startups. You've got hundreds, thousands of startup companies wanting to work with all of us. Well, this is one approach. We've got a rigorous committee that meets to find ways to sort of do this in an organized and constructive way. And so I'll end with this slide. This is more on now the what's in it for everybody slide. So what's in it for the startup companies? Well, they get access to us and many of you potentially mentors from the hospital, doctors, nurses, pharmacists, administrators, IT folks. It's stuff, these guys would love to have meetings. We're going to pack their days full of these meetings, where typically they'd love to have a meeting like this every month. They'll get this office space in Los Angeles, which is not cheap, but we'll give it to them for 3 months. They'll have this network from Techstars that can help them really grow their business. Ideally, some pilots with Cedars-Sinai, access to investors, press, industry leaders, and some seed funding as well. And for us, it's really a great way for us to actually be able to influence healthcare innovation. So to the points made earlier, it's hard. It's hard to work with startup companies. It's hard to build by. We have innovation labs at Cedars-Sinai, people that build a lot of stuff for us. But at the same time, this is a way to accelerate the pace of that growth really quickly. That by June, we'll have worked with 10 companies that are really ready to launch, ready to pilot, and it took 3 months for us to do so. So it's a different model for how healthcare systems can work with and partner with startup companies, and we're really excited about how it could potentially help all of us. And so there's it's my contact information. I want to be really brief and provide an update. If there's any questions, I'm happy to answer them now, or if you wanted to shoot me an email, again, I'm the director of the Healthcare Innovation Accelerator at Cedars-Sinai, and my contact information is on the screen. Any questions?